Basically, when rabbits come in to see us, one of the vet does an initial consult. We use things like these things. We video how they move, and we try to figure out like what their specific issue is. Then we do a regular physical, and then we do what we call a rehab exam. So we do that with, this is measuring muscle girth, so we kind of put this around their legs and how big are they and what's the difference between that weak side and that strong side, and that helps us monitor how things are going. We do a neuro exam because by the time they come in, they have neuro issues usually. And that just helps us locate where the biggest problem is along the spinal cord. And then we use this thing. This is a goniometer, and this basically measures comfortable range of motion. So we measure kind of the worst parts of the rabbit so that we can monitor it, so we can figure out. And that's how we determine that day what we give you to do at home. What side's weaker, where's there the most spinal pain, which are the biggest inflexibilities due to our measurements. Then we do soft tissue palpation too, of muscles and structures. We do acupuncture as a major part of the treatments. I think it's just really helpful. There's like Western reasons why acupuncture works, and then there's Eastern reasons. I think they all are true. But in kind of our Western way, acupuncture releases feel-good hormones. It does that at the level of the spinal cord. It does that in the level of the brain, including serotonin, which there's only a couple things that can make humans get that. Exercise, sex, chocolate. I was like, woo! Okay. So acupuncture's like, does that. There's also different other ways that it works. It increases circulation to the area, and that can help take out free radicals or issues that are, that are happening there. It also does something called the gate theory, which is a pain concept theory where if this hurts and I make this hurts less. And that's a real thing where your brain changes its mind. It's like, I'm going to focus over here. Pain is real, but it's all perceptions. So if you can trick how this whole thing goes, that's a lot of the concepts of managing chronic pain and the meds we use and stuff. We're trying to trick it, and redirect it and make it confused and all that kind of stuff. So I think it's great. We also use a lot of injectables during our acupuncture treatment. Studies show if you inject something into an acupuncture point, the results of acupuncture last longer. So if we do acupressure, like this, acupuncture, the needle, electroacupuncture, which is the little electrodes that we clip on, or we inject, in that order, the effects of acupuncture last the longest. So we prefer to do electrodes, but sometimes they chew them, and sometimes they hop around. And we have certain, sometimes it works, sometimes it doesn't. But we do injectables. So as part of their treatments, we do B12, which is a good immune booster, really good for the nervous system to be like, hello, you need this. Good for digestion, which obviously rabbits need that stuff. But we'll do it into acupuncture points, called either aquapuncture or biopuncture. So that's part of also what we'll do.